All right, get ready because today we're diving deep into a topic that's been getting a lot of attention lately.
Yeah?
Testosterone replacement therapy, or TRT.
TRT.
We've got excerpts from this book.
Okay.
It's called Revitalize: Understanding Testosterone Replacement Therapy for Men.
Catchy.
And it seems like it covers just about everything you'd want to know about, well, about TRT.
Yeah, it's a pretty comprehensive guide.
So if you're curious about what it is, who it's for, the potential benefits, the risks, well, you're in the right place.
Absolutely. It's a fascinating topic because it really touches on so many aspects of men's health.
Okay, so let's start with the basics.
Okay.
This book refers to testosterone as the man behind the curtain.
Right.
So what exactly does it do for men, and why is it so important?
You can kind of think of testosterone as this master regulator.
Okay.
It influences a ton of things, like muscle mass, body fat, how it's distributed, libido,
Huh?
even bone density.
Wow.
But it's not just physical stuff. Testosterone also plays a role in energy levels, your mood, how you regulate your mood, cognitive function.
So it's not just about, feeling strong or having a high sex drive.
Right.
It's about, I guess, feeling good mentally and physically overall.
Exactly. Feeling good overall. And here's where things get interesting.
Okay.
Testosterone levels naturally decline as men age.
Mm.
Starts in their late 30s, about 1% per year.
Oh, wow.
And even more than that,
Yeah.
a recent study that was published in the Journal of Clinical Endocrinology and Metabolism actually found that this decline is linked to a higher risk of cognitive impairment later in life.
Really?
And even dementia.
Wow, that's a pretty compelling reason to pay attention to testosterone levels.
Yeah.
But how do you know if your testosterone is actually low?
Right.
I mean, is it just a matter of feeling a little sluggish, or are there more specific things to look out for?
Well, feeling tired or having low energy, those can definitely be symptoms.
Yeah.
But they're not always a sure sign on their own. The most accurate way to know for sure is to get a blood test.
Okay.
This test measures both your total testosterone and what's called free testosterone, which is the amount that's not bound to proteins in your blood.
Gotcha.
So it's basically available to act on your cells.
So free testosterone is the one that's actually doing the work.
Precisely.
Interesting.
And this is where things get a bit more nuanced.
Okay.
The normal range for total testosterone is usually between 300 and 1,000 nanograms per deciliter.
Okay.
That's NGDL.
Got it.
But individual needs can vary.
Right, of course.
And what matters most is how you feel.
Uh-huh.
Even if your levels are technically normal,
Okay.
you might still have symptoms of low testosterone.
So if you're feeling the effects, even if your numbers look okay, it's still worth talking to your doctor.
Absolutely.
Okay.
And that's where TRT comes in.
Okay.
It aims to get your testosterone back to a healthy level so you can improve your symptoms, have better quality of life.
All right, so let's talk about TRT. Who exactly might benefit from this therapy? Is it just for older guys who are experiencing a natural decline, or are there other people who might consider it?
Well, men with clinically low testosterone
Okay.
and who have noticeable symptoms.
Gotcha.
They are usually the best candidates, but it's not a one-size-fits-all solution. That's really important to note.
Right, of course.
Every individual is different.
Of course.
Everyone has their own needs, their own health history. All of that has to be taken into account.
So it's not like just popping a pill and hoping for the best.
Right.
There's a real process involved.
Exactly.
And speaking of process,
Yeah.
there's this interesting evolution happening in the way TRT is given.
Right.
I mean, injections, those have been the traditional go-to method.
Yeah, that's the classic.
But now we're seeing some really cool new delivery systems pop up,
Totally.
like subcutaneous implants, buccal tablets.
Pretty amazing.
It sounds like there are options for all kinds of different preferences and lifestyles. But before we get too deep into the different ways it's given,
Yeah.
let's talk about something that always comes up when we talk about testosterone. Athletics.
Ah, yes, the athlete's dilemma.
Right.
It's a fascinating area where the discussion gets really interesting.
Yeah.
Because it brings in performance enhancement and ethical considerations.
So why is testosterone so sought after in sports? What makes it so appealing to athletes?
Well, think about what's at the core of athletic performance.
Okay.
muscle growth, strength, power, endurance, recovery.
Yeah.
Testosterone is involved in all of that.
Really?
It can do things like increase muscle protein synthesis,
Hmm.
boost your red blood cell production.
Huh?
It can even improve your mental focus and drive,
Huh?
which are obviously incredibly valuable to athletes trying to reach peak performance.
Right. It's like this, like a turbo boost for the mind and body.
Yeah,
No
exactly.
wonder it's tempting.
But that's where the ethical tightrope comes in.
Yeah.
There's a very big difference between using testosterone therapeutically,
Okay.
so to address a real deficiency, versus abusing it to get a performance edge.
Yeah. Yeah.
The World Anti-Doping Agency, WADA,
Right. What do you
have very, very strict rules
Yeah.
about using testosterone in sports.
Gotcha.
And the penalties if you break those rules are serious.
Okay. That makes sense.
Yeah.
But what about older athletes who are dealing with age-related decline?
Right.
Their performance is not what it used to be.
Sure.
Could TRT help them get some of that edge back?
It's a good question.
Yeah.
It depends a lot on the individual athlete.
Okay.
TRT might help them feel more like their younger selves,
Uh-huh.
but you have to think about the ethical side
Yeah.
and the potential risks.
Right.
Are they really just getting back what they had naturally?
Yeah, yeah.
Or are they gaining an unfair advantage over younger athletes?
Right, right.
There are no easy answers.
Yeah, it's not black and white.
Not at all.
There's a lot to consider when we talk about TRT in athletes.
Absolutely.
But let's shift gears a bit now
Okay.
and talk about something anyone thinking about TRT needs to know.
Okay.
The risks. Because let's be real,
Uh-huh.
there's always another side to the coin.
For sure.
So lay it on us.
Okay.
What are we talking about here? What are some of the risks?
Some common side effects are things like acne, oily skin, fluid retention, and even hair loss.
Yeah, none of those sound particularly fun.
Yeah, they're not exactly changes you want to see,
Right.
but they can be managed.
Okay, how so?
The key is working with your doctor.
Mm.
Regular checkups, blood tests, those can track your hormone levels and make sure everything's balanced.
Okay,
And communication is key.
right.
If you're having side effects, let your doctor know.
Makes sense.
They can adjust your dosage or even try a different way of giving you the testosterone.
So it's not a set it and forget it type of thing.
Not at all. It's an ongoing process.
Gotcha. So that's for the more common, I guess, less serious side effects.
Right.
What about the long term? Are there more serious risks we should be aware of?
Yeah, there are some potential long-term risks, especially if you use TRT for a long time.
Like what?
Well, one area of concern is cardiovascular health.
Okay, the heart.
Some studies have shown a possible link between TRT and a higher risk of heart attack and stroke. Although there's still a lot of research being done on this.
So it's not a guarantee that TRT will hurt your heart,
Right.
but it's definitely something to talk to your doctor about.
Absolutely.
Okay, what else?
Well, there's also the issue of hormonal imbalances. TRT can suppress your body's natural production of testosterone.
Oh, okay.
So you have to work closely with a healthcare professional to make sure you find that right balance.
Because messing with your hormones can have, I guess, unintended consequences.
Exactly.
All right. And are there any others we should know about?
We also can't forget about the potential psychological risks. Some men experience mood swings, increased aggression,
Wow.
or even develop a dependence on TRT.
So it sounds like TRT is this powerful tool that really needs to be handled with care.
Exactly. It's not a decision to take lightly at all.
Right. So it's not just about raising your testosterone. It's about understanding how all these things work together. The hormones, the health risks, what each person needs. It's complicated.
It's a complex system,
Yeah,
for
right.
sure.
But let's not forget,
Yeah.
testosterone, it affects more than just our muscles and energy levels, right?
Absolutely.
It plays a big role in how we feel mentally and emotionally, too.
Very much so.
And that's what we'll explore next time in part 2.
We'll dive into that fascinating connection
Yeah.
between testosterone and mood.
Okay.
We'll look at how TRT can impact mental health, both the good and the potentially bad.
Sounds good. I'm looking forward to it.
Me too.
Welcome back.
Okay, so last time
Yeah.
we talked about what testosterone does, like the basics.
Right. We set the stage, and then we got into, the potential good and bad of TRT.
Exactly, the ups and downs.
So now let's get practical.
Okay.
Like if someone's thinking, okay, TRT might be for me,
Yeah,
where do they even begin?
that's a great question.
It's not like you can just walk into any pharmacy and pick up some testosterone.
No, definitely not.
So what's the first step?
The most important first step is talking to a doctor.
Okay.
But not just any doctor.
Okay.
Someone who really understands hormones.
So we're talking specialists?
Yeah, like endocrinologists, urologists, people like that.
Right, folks who really get this stuff.
Exactly. They understand the ins and outs of testosterone and how it affects your whole body.
Okay.
Your regular doctor might not have that kind of expertise.
Gotcha. So finding the right doctor is key.
Absolutely.
But what should you expect at that first appointment? Is it all like serious medical talk? Or do they, ask about your feelings too?
It's a bit of both.
Okay.
Be ready to talk about your symptoms in detail. What you're feeling, how long it's been going on, how it affects your life day to day.
Right.
They'll also want to know your medical history.
Okay.
Any meds you're taking, your lifestyle, like diet, exercise, all that.
Right. Because it's all connected.
Exactly. Testosterone doesn't exist in a vacuum.
It's part of the whole system.
Exactly.
And of course, blood tests, those are standard.
Yeah, definitely.
They'll check your testosterone levels.
Right. Not just the total, but also the free testosterone. Remember that?
Oh, yeah. Right. Because that's the stuff that's actually doing the work.
Exactly.
Yeah. Okay.
They might even check some other hormone levels, like SHBG.
SHBG, what's that?
It binds to testosterone.
Oh.
And that affects how much is actually available to your body.
Interesting.
So it's not just about one number.
Right. It's about the whole picture.
Exactly. Getting a sense of the whole hormonal scene.
Okay. So the doctor has all this info. Then what?
Then comes the important part.
Okay.
Weighing the risks and benefits of TRT.
Right. Decision time. What are the key things to think about when you're making this choice?
First, be clear about your goals.
Okay.
What are you hoping TRT will do for you? More energy, better mood, improved physical performance, or maybe all of the above?
Right, because it's not like a magic cure-all. It's about targeting specific concerns.
Exactly.
Okay, so goals. What else?
Think about your medical history. Are there any conditions that might make TRT risky?
Like what?
Heart problems, prostate issues.
Okay.
Your doctor will definitely consider those.
And what about lifestyle? Does that matter?
Absolutely.
Right.
TRT often works best when it's combined with healthy habits. Good food, regular exercise, managing stress.
So it's not a replacement for those things?
No, it's more like a partner.
It works alongside them.
Exactly. You can't just take testosterone and expect miracles without putting in the work yourself.
Gotcha. It's a commitment, not a quick fix.
Exactly.
Okay, so let's say someone's talked to their doctor, they thought about the pros and cons, and they've decided to go ahead with TRT.
Right. They're ready to take the plunge.
What happens then?
Then the doctor creates a personalized plan.
Okay.
They'll discuss the different ways to take testosterone.
Right, all those different delivery methods.
Exactly.
Injections, gels, implants, even those buccal tablets you just pop in your mouth.
Yeah, there's a whole range of options these days.
It's pretty amazing how it's evolved.
It really is.
So the doctor takes into account your preferences,
Yeah.
your lifestyle, your medical needs.
Exactly. It's not one size fits all.
Okay, so they figure out the best way to give you the testosterone.
Right. And they'll keep an eye on how you're doing.
Okay.
They might adjust the dosage or even change the delivery method if they need to.
So it's like an ongoing conversation with your doctor.
Exactly. Open communication is key throughout the whole process.
Okay, that makes sense.
But there's something that often trips people up.
What's that?
Setting realistic expectations.
Oh, right.
I think a lot of guys have this Hollywood image of TRT. Like you take a shot and boom, you're 20 again.
Right, muscles bulging, energy through the roof.
Exactly. But while some men do see really big improvements,
Yeah.
it's important to remember that everyone responds differently.
Okay.
And results take time.
So patience is key.
Absolutely.
You're not going to turn into Superman overnight.
Right. It's a process.
And TRT, it's not a fountain of youth.
No, it's not.
It can help with certain symptoms,
Right.
but it won't reverse aging.
It's about improving your quality of life as you get older.
Yeah, not erasing the years.
Exactly.
Okay, that makes sense.
Now, there's one group we need to talk about separately.
Okay,
Athletes.
right, athletes.
Because when it comes to TRT and sports, things get a lot more complicated.
Yeah, ethically, it's a whole different ballgame.
Exactly.
Because testosterone can give you an advantage.
Yeah.
So where do we draw the line between, playing fair and getting an edge?
That's the core issue. Fairness.
Yeah.
Is it ethical for athletes to use TRT to get ahead of those who don't? And if so, when is it okay?
Because if it's just about boosting your performance beyond what's natural, that seems kind of, unfair.
Yeah, it can be a slippery slope.
So where do we start with this?
The key is to separate therapeutic use from performance enhancement.
Okay.
If an athlete actually needs TRT for a medical reason,
Okay.
meaning their testosterone is clinically low.
Right, not just lower than their peak.
Exactly.
Oh.
Then using TRT to get back to a healthy level, that's generally considered acceptable.
So it's about leveling the playing field for someone who has a real medical issue.
Exactly. Not giving them an unfair boost.
Gotcha. But even then, I bet there are rules, right? Like to make sure everything's above board.
Absolutely. There are very strict regulations to prevent abuse.
Okay, so let's talk regulations. Like, what's the official stance on TRT in the sports world?
The World Anti-Doping Agency, WADA.
Right, WO, the doping police.
They're the ones who set the standards for anti-doping worldwide.
Okay.
They have very specific rules about testosterone and other performance-enhancing substances.
So athletes can't just, like, get a TRT prescription from their doctor and call it a day.
No, not at all.
What do they have to do?
If they need TRT for a medical reason,
Okay.
they have to apply for what's called a therapeutic use exemption.
Okay, a TUE.
Exactly, a TE.
But I bet those aren't easy to get.
You're right. It's a tough process.
What's involved?
Athletes have to provide tons of medical documentation.
Hmm.
They have to go through really thorough evaluations,
Okay.
and they have to prove that their low testosterone isn't because of something like overtraining.
Right, something that could be fixed without hormones.
Exactly.
So they really have to prove their case.
They do. It's like a legal battle.
And even with a TUE, I bet there's still checks and balances.
Oh, yeah, absolutely.
Yeah.
Athletes with TUEs, they're constantly monitored.
Okay.
They get tested regularly to make sure they're following the rules.
It's all about making sure the playing field is level
Exactly.
and keeping the sport fair.
Right. Protecting the integrity of the competition.
Okay, so we've talked about the rules, the ethics of TRT for athletes who need it medically.
Right.
But what about older athletes?
Hmm.
You know, they might not have a diagnosable deficiency,
Right.
but their levels are definitely lower than they were back in the day.
Sure. That's natural.
So is it okay for them to use TRT to, like, regain some of that lost edge?
That's a tough one.
Yeah.
There are strong arguments on both sides.
Okay.
Some people say if their levels are normal for their age,
Right.
then using TRT is still performance enhancement.
Right.
It gives them an unfair advantage over younger athletes.
Especially in sports where physical strength and endurance are everything.
Exactly.
But the other side argues that those older athletes are just trying to get back to how they used to be.
Yeah, they're not trying to be superhuman.
Just trying to keep up with their younger selves.
Exactly.
And there's also the concern that TRT might mask other health issues
That's right.
that can be addressed in other ways. So it's a tough call.
It is. There's no easy answer.
Yeah, a lot of factors to consider.
Absolutely. And ultimately, it's up to each sport to decide.
Yeah.
You know, they have to set their own rules, their own regulations
Right.
based on the demands of the sport and the ethical considerations.
So the conversation about TRT in sports,
Yeah,
it's going to keep going.
for sure. It's an ongoing debate.
Okay, so we've talked about the ethical side.
Yeah.
The rules around TRT in sports.
Right.
But let's bring it back to something we've been talking about throughout this whole deep dive.
Okay.
The mind-body connection.
Absolutely.
Because testosterone, it's not just about muscles and libido.
No, it's not.
It affects our mental state, how we feel.
It really does. And that's often overlooked.
Yeah, it's a crucial part of the conversation.
It is.
So how does testosterone impact our mental well-being?
Well, like we said before, low testosterone can be linked to mood disorders like depression, anxiety.
So it's not just about feeling a bit down. It can be a real mental health issue.
Exactly. It can be serious.
And that adds a whole other layer to this already complicated world of mental health.
It does. It's a complex puzzle.
Right, we're talking about how you feel emotionally, how you think. It's not just physical.
Right. It affects your whole being.
So low testosterone, that's the potential downside. What about the upside?
Yeah. What about the good stuff?
What happens when you optimize testosterone, like with TRT? Can that improve your mental state?
It can. A lot of men report positive changes.
Okay, like what?
Their mood improves. They feel more motivated, more resilient, like they can handle stress better.
So it's like TRT gives your brain a boost,
Yeah, it's like it gets a little extra support.
helps you feel more balanced,
Exactly.
more capable of handling whatever life throws at you.
Right. And for athletes, this can mean better focus, more mental toughness, which is huge in competition.
Right, because mental strength is just as important as physical strength.
Absolutely, especially when the pressure's on.
But TRT is not a replacement for professional help, right?
No, definitely not.
If you're really struggling with your mental health,
Right.
you need to see a therapist, a psychiatrist.
Absolutely. Seek help from a qualified mental health professional.
Right.
TRT might be a helpful tool alongside that,
Okay.
but it's not the whole solution on its own.
It's about taking care of your mental health in a holistic way.
Exactly. Addressing both the physical and the emotional sides.
Now, let's talk about something that often gets overlooked
Okay.
when we talk about TRT, heart health.
Yes, the heart.
Because testosterone plays a pretty interesting role there.
It does. It's more complicated than people think.
So tell me, what's the connection between testosterone and the heart?
Well, on the one hand, testosterone can actually be good for your heart.
Really?
Yeah, it can improve blood flow,
Okay.
and it can make your arteries less stiff.
That makes sense.
Both of those are good for your cardiovascular system.
So testosterone, like a heart protector.
In a way, yes.
But you said it's complicated.
I did.
So there must be another side to this.
There is, on the other hand.
Yeah. Okay.
Low testosterone has also been linked to heart problems.
Wait, so it's good and bad for your heart.
It's all about balance.
This hormone keeps us guessing.
It does. It's complex.
So what about TRT in the heart? Any risks there?
The research is still ongoing?
Science? Always evolving?
Exactly. Some studies say TRT can improve heart health.
Okay.
Others raise concerns like a higher risk of blood clots.
So no clear answer yet?
Not yet.
But what if you already have heart problems? Is TRT off the table?
Not necessarily, but
Okay.
it's super important to get your heart checked out before starting TRT.
Okay.
A cardiologist can help you weigh the risks and benefits.
So talk to your doctor, folks. Get those tickers checked.
Absolutely.
Okay, what if the cardiologist gives you the green light? Anything else to keep in mind?
Even if TRT is considered safe,
Yeah.
you still need regular monitoring. And you need to make healthy lifestyle changes.
Diet, exercise, all that.
Exactly. It's about being proactive.
Not just relying on TRT to fix everything.
Right. It's a team effort.
Okay, let's switch gears one last time.
Okay.
Let's talk about those new ways to take testosterone.
Yes, the delivery methods.
It's not just needles and pills anymore.
It's a whole new world.
Give us the rundown.
Okay, we've got the classics, intramuscular injections.
Right, the OG method.
They work, but they can cause those hormone swings.
Yeah, the roller coaster.
Exactly. Those ups and downs can be tough.
What else is there?
There are subcutaneous implants.
Those are the little pellets.
Yeah, tiny pellets inserted under your skin.
Okay,
They release testosterone slowly over time.
so more stable levels.
Exactly. No more roller coaster.
I like the sound of that.
They last for a few months.
Wow, that's convenient.
Yeah, no need for frequent injections.
But there's a catch, right?
There is, you need a minor surgery to put them in
Okay,
and to take them out.
interesting. What else?
There are topical gels.
Those seem popular.
Yeah, they're easy to use.
Okay.
Just rub them on your skin.
And they give you pretty steady testosterone levels.
Right, but there's a slight risk of transferring the gel to someone else.
Oh, like if you touch someone.
Exactly, so be careful with that.
Okay, so maybe not the best option if you're a cuddler.
Right.
Okay, what about the really new stuff, the cutting-edge technology?
Now we're talking the future of testosterone.
I'm ready for an upgrade.
Okay, well, there's a new generation of those subcutaneous implants.
Even better than the old ones.
Even better, they release testosterone even more consistently,
Wow.
and they last even longer.
So fewer trips to the doctor.
Exactly, more convenience.
I like it.
And then there are buccal tablets.
Those are the ones that dissolve in your mouth,
Right, super discreet.
like a breath mint.
Yeah, exactly.
It's going wild.
They're absorbed quickly.
Okay,
So you get the testosterone into your system fast.
interesting.
And then there's inhalation therapy.
You're kidding?
Nope, you breathe in the testosterone.
Through your lungs.
Yep.
Wow.
It allows for really precise dosing, and you can adjust it easily.
So you have more control.
Exactly.
Okay, my mind is blown.
Lots of options these days.
So, with all these choices, how do you pick the right one?
That's where your doctor comes in.
Right?
They'll consider everything, your needs, your preferences, your lifestyle, your medical history.
So it's not about chasing the latest trend.
No, it's about what works best for you.
And it's important to remember, TRT, it's not a one-time fix, right?
It's a journey.
It takes time. It takes communication with your doctor
Absolutely.
and a willingness to adjust along the way.
Exactly. It's a partnership.
So it's not a magic bullet.
No.
It's a tool to help you be your best.
Right. A tool to optimize your health and well-being.
That's a great way to put it.
And that's what this whole deep dive has been about, exploring all the different sides of testosterone and how it affects men's lives.
The physical side, the mental side, the emotional side.
It's all connected.
And we've talked about the potential benefits of TRT.
Yeah, for men dealing with age-related decline or other conditions that lower their testosterone.
But we've also stressed the importance of being careful,
Absolutely.
talking to your doctor,
Open communication is key.
and really understanding the risks.
You have to make informed decisions.
Right, knowledge is power when it comes to your health.
Couldn't agree more.
Now hold on tight, folks, because in part 3,
Ooh, the final chapter.
we're diving into a topic that's always controversial.
Yeah, this one gets people talking.
The ethics of using testosterone in sports.
Buckle up.
We'll be talking about the rules, debates, the challenges.
It's gonna get.
All right, welcome back to our final part of this testosterone deep dive.
We've covered a lot of ground.
We have, from the science behind testosterone to all the ins and outs of TRT.
All the details.
And now we're stepping into an area where testosterone has always been a hot topic, sports.
The world of athletics, always a fascinating area.
It's where things get, well, complicated.
Complicated, definitely, because...
On the one hand,
Yeah.
testosterone is natural, it's in our bodies.
Right.
But it can give athletes a serious performance boost.
A significant edge.
So how do we navigate the ethics of using testosterone in sports?
It's a tricky one.
It really is. Where do we draw the line between fair play and an enhancement?
Yeah, that's the million-dollar question, isn't it?
It is. So let's just get right to it.
Okay.
Is it ever okay, ethically, for athletes to use TRT?
It's not a simple yes or no answer.
I figure.
It really depends on the context, the specific situation. There are a lot of nuances.
Okay, yeah, I get that. So walk us through those nuances.
Okay.
When might TRT be considered ethically acceptable in sports?
I think the key is to look at the purpose of using TRT.
Okay.
If an athlete has a legitimate medical need,
Right.
meaning their testosterone levels are clinically low.
Not just lower than their peak years.
Exactly, that's important.
Okay.
Then using TRT to bring those levels back up to a healthy range, that's generally considered ethically acceptable.
So it's about making things fair for someone with a real medical issue.
Exactly.
Not about giving them a boost over everyone else.
Right. It's about leveling the playing field, not tilting it in their favor.
Gotcha. But even in those cases,
Yeah.
there are rules, right?
Oh, yeah,
Want
absolutely.
to make sure no one's taking advantage.
There have to be safeguards in place.
So what's the official stance on TRT in the world of professional sports? What are the rules?
Well, the World Anti-Doping Agency, WADA,
Right, WADA.
they're the ones who set the global standards for anti-doping.
Okay, the doping police.
So they have very specific rules about testosterone
Okay.
and any other performance-enhancing substances.
So athletes can't just go to their doctor, get a TRT prescription, and that's it.
No, not at all.
What do they have to do?
If they need TRT for a medical reason,
Okay.
they have to apply for something called a therapeutic use exemption.
Right, a TE, we talked about those before.
It's exactly a TE, and those are not easy to get.
What does getting one involve?
It's a pretty rigorous process. Athletes have to provide a ton of medical records. They have to go through extensive evaluations.
Wow.
And they have to prove, without a doubt, that their low testosterone isn't caused by something else.
Like overtraining?
Exactly, or some other factor that could be addressed without using hormones.
So they really have to make their case.
They do. It's like a legal battle.
And even with the TE, there's still oversight, right?
Absolutely.
Like what kind of stuff?
Well, athletes with TUEs, they're subject to ongoing monitoring, regular testing, making sure they're staying within the guidelines.
So it's all about keeping things fair.
Yeah, making sure everyone's playing by the rules.
And protecting the sport.
Exactly, maintaining the integrity of the competition.
Okay, so we've covered the rules, the ethics of TRT for athletes who have a real medical need.
Right, when it's for therapeutic purposes.
But now let's talk about a tricky area. Older athletes.
Okay, yeah, this is where it gets interesting.
They might not have a testosterone deficiency that you can diagnose, but their levels are definitely lower than they were in their prime.
Which is natural. It happens to all of us.
So is it fair for them to use TRT to try to get some of that edge back?
It's a tough question.
It is. What are the arguments?
Well, some people say even if their levels are normal for their age,
Okay.
using TRT is still a form of enhancement.
Okay.
It gives them an advantage over their younger competitors.
Especially in those sports where strength and stamina are so important.
Exactly.
But then others argue that those older athletes
Yeah.
They're just trying to get back to how they used to be.
Right. They're not trying to become superhuman, just reclaim their former abilities.
Trying to keep up with their younger selves, not necessarily outdo everyone else.
Exactly. It's a subtle but important distinction.
And there's the worry that TRT could be masking other health issues.
That's a valid concern.
Things that could be addressed in other ways.
Right. So it's not a decision to be made lightly.
It's complicated.
Very complicated.
So what's the bottom line? Who decides?
Ultimately, it's up to each sport's governing body.
Okay.
They have to set their own rules, their own regulations, taking into account the specific demands of their sport.
Right. And ethical consideration.
Exactly. It's a balancing act.
So it sounds like this conversation about TRT in sports, it's not going away anytime soon.
No, it's an ongoing debate, and it will probably continue for a long time.
All right, well, let's shift gears one last time.
Okay.
Back to something we've touched on throughout this whole deep dive. The mind-body connection.
The interplay between our physical and mental states.
Because testosterone, it's not just about physical stuff.
Right. It's not just about muscles and libido.
It affects how we feel, mentally, emotionally.
It affects our mood, our motivation, our overall sense of well-being.
Exactly. And we talked about how low testosterone can lead to things like low mood, lack of motivation,
difficulty concentrating,
even anxiety and depression.
It's a significant impact.
And while TRT, it shouldn't be seen as the main treatment for those things.
Right. It's not a cure-all for mood disorders.
It could be part of the solution in some cases.
Yeah, it can play a supporting role.
So if someone has low testosterone and they're also struggling with low mood, addressing that hormone imbalance, it could potentially help.
It could provide some relief, but it's crucial to work with the right healthcare professionals.
Specialists who understand both hormones and mental health.
Exactly. You need a team approach.
It's about treating the whole person.
Not just focusing on one symptom in isolation.
And that brings us back to the heart of what we've been exploring. Testosterone, this powerful hormone.
Affecting so many aspects of our lives.
It affects us physically, mentally, emotionally.
It's a key player in our overall health and well-being.
We've learned about its role in everything, from muscle growth and energy levels
to mood regulation and even heart health.
We talked about how TRT can be beneficial
for men experiencing age-related decline
or other conditions that cause low testosterone.
It can be a game changer for some men.
But we also emphasize the importance of being informed.
Absolutely.
Talking to your doctor, understanding the risks, making those decisions carefully.
Knowledge is power when it comes to your health.
Couldn't agree more.
So if you're considering TRT or just curious about it,
do your research.
Talk to your doctor.
Make the choices that are right for you.
It's your health, your life, your decision.
Well said. And remember, this deep dive, it's just the beginning.
It's a starting point. There's so much more to explore.
Keep learning, stay curious.
Absolutely.
And we'll catch you on the next deep dive into the fascinating world of knowledge.
Until next time.